friends, welcome to today's video. So today we'll be discussing in detail about the disease which is known as a mycormycosis. It is also known as a black fungus. Recently in Maharashtra, about 1,000 people were found to be infected by disease. And now it is mostly found in the COVID-19 patients. The patients who were affected by COVID-19 are prone to this disease. So we'll see in detail. So starting with mucormycosis, it is also known as a black fungus. The other name is black fungus. So how it is caused by? It is caused by a microorganism which is known as a mucormycetes. So this is the technical name of the organism which is causing this disease. These microorganisms are present naturally in the environment. It means our environment normally consists of these microorganisms. So where it is seen in the environment? It is seen mostly in the soil and in the decaying organic matter like the tree leaves, the compost and the piles. So this is where it is normally seen. So since we are saying that this is present naturally in the environment, then why is that this disease is so affecting nowadays? So in general, if you see, our body immune system successfully fights such small fungus diseases. So this is our normal person who is healthy, his immunity system will fight against it. But then nowadays it is found mostly in the diabetic patients. So diabetic patients are more prone to it. So what are the symptoms of this disease and how it spreads? It is generally starts with a skin infection. So how the skin infection happens is in our skin, there are small air pockets which are located on our body on certain parts, like behind the forehead, on the nose, cheekbones, and in between the eyes and the teeth. So from these air pockets, this fungus means these microorganisms will enter into the body and then it starts with a skin infection. And what happens is slowly it spreads to the eyes, lungs, and it can also sometimes it can spread to the brain also. So what are some of the common symptoms are like blackening or the discoloration over the nose. So like we can see some that your nose is appearing to be more black in color, or double vision, you are not able to see properly, there is a slight chest pain and you are found some breathing difficulties, and sometimes in your cough the blood is also seen. So these are some of the common symptoms and how this fungus spreads. So why is that the COVID-19 patients are more to this disease? So we know this in general, the COVID-19 affects our immune system. So patients who are affected with COVID-19, they have a low immunity system. So why does this happen? Is like patients who are also taking the drugs like the dexamethasone. So this will generally suppress the immune system. And also the patients who are in ICU for taking the oxygen therapy who are affected with COVID-19, since in ICU the humidifier is used, and since this is found in general environment, so when the patients are exposed to this air, means moisture in ICU room, then they are prone to the infection. So who are the more people who more risky? We have said that the people with low immunity systems are more affected. So like the patients who are affected with the COVID-19, and especially if you see people who are having high diabetes or uncontrolled diabetes, these are more susceptible to this disease. And like weakening of the immune system due to use of steroids. So people who are on steroids, in general the steroids causes a bit of low immunity system. So they are also more prone to more risk to this disease. So people who are in prolonged stay in ICU or in the hospital stay, they are more risky. Who are having the comorbidities like some other diseases like organ transplant, and who are cancer patients. And sometimes it is also seen in the patients who are undergoing the varicocele therapy, which is used to treat the other fungal infections. So these categories of people are more risky for this disease. So what is the treatment for this disease? If your certain part is affected by the disease, then what happens is the treatment is involves surgically removing the dead and the infected tissues. So the tissues of the body parts which is affected are being surgically removed. So this is the general treatment. And also the other cure that is there is like the course of intravenous antifungal therapy. So antifungal therapy, which will prolong for 4 to 6 weeks, is also one of the treatment. So what is the best method is like you have to control the diabetes. Since we have known that diabetes patients are mostly risk at this disease. So first you have to take that the diabetes has to be controlled. Next, how we can prevent this? So what are the steps which a normal person can take? So some of them are the precautionary steps are you have to use your mask. Since we have known that it is found in the normal environment in the soil and the compost in these areas which are somewhat dusty. So in this case, if you have to use your mask if you are visiting the dusty construction site. So this is one of the precautions you can take. In addition to that, you can wear the long shoes since it goes through the skin. So wearing long shoes, long trousers, long sleeve shirts and gloves while handling the soil or gardening, moss or manure. So in this case, you have to what it is in general prevention is you have to prevent your exposing your skin to these areas. And like another important thing is you have to increase your immunity. You have to keep your immunity in check. So that can happen by maintaining a personal hygiene, by having a good bath, thorough like scrub bath. So these are some of the common measures which you can take to prevent this disease. So if you have liked the video, hit the like button and subscribe to the channel for more amazing videos. And thank you for watching.